Hi, good morning Hayden. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 2nd of February 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Hayden Strauss.
And what is your candidate number, please?
My candidate number is 234289192.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to really listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can go in helping make someone comfortable. In addition, I learned that addressing their concerns and communicating in an assured manner make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when you just can't do more. Seeing someone in pain, or feeling miserable, and knowing there's nothing you can do to help, is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
How do you handle the stress of the job?
I find the best way to handle the stress of being a nurse is through meticulous organization and attention to detail, by making lists and prioritizing what needs to get done throughout my day. I find that tasks which might seem overwhelming all at once are much more manageable. This also makes it possible for me to stay calm and remain focused on what needs to get done when unexpected situations arise.
Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I really enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating, and am equally comfortable working alone.
Would you say you're a team player?
Yes, of course. I really enjoy working in a team. I often find it helpful, as I get assistance and could deal problems efficiently, which I might not be doing on my own. I also enjoy sharing techniques each other and helping colleagues with their work.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, that's fine.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your role play. Don't worry if I stop you when the time is up.
Good morning, Mihiraa. I am your son, Sam's attending nurse, Hayden Strauss. I'm here to inform you about his condition and to discuss the treatment that the doctor has recommended for him.
Good morning, nurse. Sure, you may please tell me about his condition.
Mihiraa, I am sorry to inform you that the doctor has diagnosed Sam's condition as atopic eczema, which is the most common form of eczema, a condition that causes the skin to become itchy, dry, and cracked.
Oh, no. Has he got atopic eczema?
Unfortunately, yes. But Mihiraa, try not to worry about it. Atopic eczema is more common in children and can be treated effectively by the administration of oral medication.
What? Oral medications?
Yes, Mihiraa, the doctor has prescribed a corticosteroid for Sam. Is there any problems?
He doesn't need any oral medications. No, nurse.
Mihiraa, in order for his speedy recovery, the doctor has prescribed corticosteroids for him. It will be helpful for Sam to get cured quickly without complications.
No, nurse, I won't allow any oral medications to my son. Oral medications are harmful. It will only affect my son's health adversely. This condition will be cured without any oral medications.
Well, Mihiraa, I can assure you that the prescribed medication is not harmful to Sam. By taking the doctor-prescribed corticosteroids, Sam will get better relief. I can reassure you that the medication will lower the inflammation in his body and can reduce swelling. Most importantly, the itchiness he currently has will be subsided to a greater extent and make him feel much comfortable. Slowly, the redness over his skin will diminish, and the allergic reactions will be under control.
I hear what you have said. But nurse, I know the oral medication will harm my son, and it is not good for his health. His condition will be subsided with good nutrition and ointment. I won't allow any medication to endanger him.
Please be relaxed, Mihiraa. I can understand how conscious you are of your son's health. I would like to bring your attention to why it is necessary to take oral medication along with topical medication. If Sam takes oral medication prescribed by the doctor, along with the ointment, Sam's recovery will be much quicker. Thus, Sam can lead a normal life without much suffering.
Nurse, I know you people will say all these points to fool me. It is for the incentives you receive for selling the medication. My son doesn't need any medication. He will be all right.
I acknowledge your words. Mihiraa, please be patient to hear what I have to say.
All right, let me hear what you are going to say.
Thank you for your willingness, Mihiraa. Now, let me inform you about what will happen if it is untreated. Atopic eczema, if left untreated, will spread quickly and lead to further complications. In later stages, blister formation will happen around his body, and when it breaks, it will become infectious. That will be more distressing for Sam. Moreover, it will further lead to adverse health reactions.
No. You are trying to make me panic by saying these things.
Absolutely no, Mihiraa. It is exactly what is going to happen if the atopic eczema is not treated properly.
But nurse, the medications will be having side effects. What about the negative effects of medication on my son's health?
Mihiraa, I understand your worries. Do not be overly concerned about the medication and its after effects. What we can offer you is that we will provide additional support to your son after administering the prescribed medication. That is, we will monitor your son closely after the administration of medication to check for any after effects. Only after satisfactory conditions, we will discharge your son. How does that sound, Mihiraa?
All right. That sounds good.
Thank you for your understanding, Mihiraa. I will make the necessary arrangement for his observation. Now, can I have your consent to administer the medication to Sam?
All right, nurse. You may please.
Thank you for your consent.
That is the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.